Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Welcome back to our second episode on fibromyalgia. You are listening to Since You Put It That Way podcast, the segue into cosmic health and wellness with our special guest, Carol Ritberger, who co-hosts this with me because we go from the allopathic world to the osteopathic world to the intuitive world to the cosmic world. And then we wrap it all back up again. So welcome back, Carol. It's lovely to continue this conversation on fibromyalgia. To give a quick summary for those who didn't listen to part one, first go listen to part one because it's about 40 minutes long. You'll love it. Great time to do your exercise. Fibromyalgia, historically, it's been around for a long time, different names. We think because of the evolution of the immune system and our understanding of the neuromuscular system and our fascia. That's the summary there. It has many levers in infections like viruses, bacteria, vectors like Lyme, emotional trauma, physical trauma. Probably we could throw hormonal in there. And so because there is many ways in, that gives us many ways to access how to care for a patient or a client. It's a widespread pain pattern and widespread pain issue with sleep problems, some mood disorders, and some brain fog. Okay. Versus being, it hurts my arm when I do this because I've been doing that forever. So the first thing what we talked about was the accuracy in diagnosis. So I'm going to go a little bit deeper into that, and then we'll segue into treatment. Then we'll go off into the cosmos. How's that? So, so comparison, if we look at myofascial pain syndrome versus fibromyalgia, which we maybe, Carol and I gave it a new word, fasciomyalgia. We gave it that word too. With the myofascial pain syndrome, which people have a lot of, that's repetitive activity or overuse leading to the strain on a particular muscle fiber or muscle itself or muscle system, like the shoulder would be considered a muscle system. It's got localized muscle pain and trigger points that cause radiating pain, not nerve pain when it radiates, but when you push on it, it radiates out within the muscle itself. And it's got muscle stiffness associated with that. And it may be acute or chronic. Chronic, we tend to say lasts 3 to 6 months or longer. And we do a physical exam and we find literally the difference between left and right. So if I spend all my day hammering and then I go home and it aches down my shoulder, it aches into my bicep area. My forearm feels kind of achy. And then when I go to reach for something, it really aches. That's not fibromyalgia. That is musculoskeletal pain. And that most likely is a rotator cuff issue because that I just actually accurately described what can happen to the rotator cuff. The treatments for those two things, and then contrasting the fibromyalgia, let's go there. Widespread pain, fatigue, difficulty sleeping, headaches, depression, anxiety, and then the brain fog. So you know, we talked about in the last segment, 11 to 18 points you have to qualify. And then the origins of that came from standardization for research, but then got conflated into clinical medicine. So it's not, the 11 to 18 points has only been used for research, but we borrowed it. And I don't think rightfully so. And never was it differentiated because I've lost count how many lectures I sat in that defined it with the 11 to 18 points, you know, and no one ever said it in the research. And then I look historically at it and that's exactly what that was for only. And then fibromyalgia is a long lasting condition. So think longer than 6 months. It may be worse in the morning with certain triggers, such as changes in temperature. I would throw in there changes in humidity and stress and hormonal changes as well. And we get that understanding by doing a good history and physical examination. And the muscles on the arms should be pretty equal left to right. Muscles in the legs equal left and right. The back pain is more symmetrical often. You might have a little ache more on one than the other, but there's no difference in strength, no difference in functionality left to right sides. The treatment for those two vary because we use specifically for the musculoskeletal pain, we use focused modalities, ultrasound, we use myofascial release, we use trigger point injections, we use ice, we use heat, exercises, those types of things. For fibromyalgia, none of that worked, and it just doesn't work because that's not where
Mhm.
the issues are. And so we tend some of the leading treatments that we see now are with some medications that treat the psychoneuroimmune system, so the SSRIs
Mhm.
and tricyclic antidepressants, which are the old ones that bump norepinephrine and serotonin. And as we get into that discussion, we got to remember that 80% of serotonin is made and used in the gut.
Yep.
So is fibromyalgia a gut issue? Yes, and we'll explain why. And so
Mhm.
stay tuned there. And then the myofascial pain syndrome also usually resolves by itself with some treatment options. And fibromyalgia tends to be long lasting with, and it's not progressive. It doesn't change the function of the
Right.
muscles. And I think that's a real big thing to understand.
I agree.
Um, because if I have a tendonitis here in my rotator cuff and I keep doing what I'm doing, which is usually abduction, external rotation, I can damage that tendon because it's
Correct.
hitting the bone. The tendon is pushed and pinched between two bones, the humeral head and then the acromial arch, and that tendon can fray.
Mhm.
That's not what fibromyalgia does. So, so what, so Carol, in your experience, what has been your best way to separate those two for folks? A focused myofascial or focused musculoskeletal issue versus the fibromyalgia. What pearls do you have there?
Well, so very straightforwardly, from my perspective, it doesn't make any difference
Okay, fair enough.
because they're linked.
Uh-huh. Okay.
And
Say more.
yeah. Well, so if we were to say that it's a fascia expression, that's much easier for us to be able to go in and deal with. It feels like it's compartmentalized.
Okay.
Um, if we go in and we look at it, how can I say it? If we look at it as being widespread, if we look at it as not going to get any better, if we look at it as the entire body being involved in it, we don't really know where to start.
Mm,
So one of the things I found is really interesting as a medical intuitive, I'll say to people, when you're going to look at self-healing, focus on where you feel you have the greatest power to make change. If
okay.
it's dealing with the fascia, what can we do with the fascia quality of it? If it's dealing with the gut, because the gut is very much involved in it, what does that have to do with it? If it's the psychological that's expressing itself as a form of depression, but if we can break it into something that feels bite size, that we feel like we can really become engaged in, we can put together a process that's comfortable to us instead of turning into a regimen, feeling overwhelmed. Because I find with fibromyalgia, one of the things that keeps it active is that sense of overwhelm. So if we break it up into the
Great
small
point.
pieces, if we break it up into small pieces and we figure, and the beautiful part I've found as a medical intuitive is if you want to deal with this physically, deal with it physically, and everything else will heal. If you want to go in and say, okay, well, I'm feeling, stuck or I've had this trauma, we can go in and do that. Everything will heal. If we want to look at it energetically, that it's like being taking a huge, vibrant, energetic being that basically we know we can measure your aura 55 feet from you. We actually have instrumentation do that. And then fibromyalgia is taking that 55 feet of all that radiance and putting in a wetsuit that's right close to your body
Okay. You
and
lost
locking you
you.
locking you down.
Oh, okay. So you don't want them to go into the wetsuit, but that's what it feels like. It's their
That's what it feels like.
energetically, that aura shrinks because it's coming under compression
Exactly.
or constriction. Yeah.
So if we wanted to look at it energetically and people say, well, what can I do? Well, we've got chakra balancing, we've got sound therapy, tuning forks, chanting. There's a lot of things that we can do energetically. So again, excuse me for kind of ruminating on this, but
Yeah.
I think it's important for the person to know they have options, and it's important for them to choose which option that they believe beyond a shadow of a doubt that if they do that, they are going to feel better. I didn't even say cured. I said feel better. Because if you feel better, then you're psychologically better. Make
Well,
sense?
yeah, it does. It does. So, and I think we cure people if we anticipate them becoming a ham or some kind of smoked meat, right?
Ye
We're gonna
Right,
we'll cure them that way. I don't think there is such a thing as a cure because
correct, I agree.
100% of my patients die. Hopefully not soon, and hopefully not from something I've directly done, right?
Right,
That's always my caveat, and I tell people
right,
that, and then we kind of chuckle, But the point is, the human condition is we're here, we experience, we live, and then we go, to the next plane, whatever that looks like,
exactly.
and things like that. So that's inevitably going to happen. Their goal would be not even anti-aging because that's just it's an oxymoron. That just isn't even possible.
Mhm,
Because even if you slow the aging, you're not anti-aging, you're just still aging.
exactly.
And then eventually there is ultimate cell death where our entire being, transitions. But stepping back to that concept of feeling constricted, because we talked about fibromyalgia, people feeling boxed in,
Mhm,
wet like a wetsuit where they can't move and shrinks down their aura, or their muscles are stiff, or their movements that they feel trapped. I wonder, and one of the things I've seen is folks want to, and then you also mentioned, if you treat it physically, then they'll get well. If you treat it emotionally, then they'll get well because the body is designed to heal.
mhm.
One of the snags I've seen in that though is where people um focus on the physical so much.
Absolutely,
And I think it becomes almost part of the pathology where they're
agreed.
so rigid about three magnesiums, two
Yep,
multivitamins, one fish oil, three primrose, four garbanzo beans, five sit-ups, and it becomes so rigid.
yep,
And then they go, I'm not any better. I've done everything correctly. And I'm like, well, that's kind of the whole point of it. There isn't a correctness through life.
right, and it's the rigidity that you're talking about, and it's a something that in the healing process we need to look at. When the body is depleted of something,
Mm,
whether it's acupuncture or whether I mean, energy or food or whatever it is, when it's depleted and you start taking something,
mhm,
you're gonna get results. You're gonna feel something that feels better.
mm,
But once the body doesn't need that, then it's time to go back and revisit. And
mhm,
it's like, okay, do I need those 4 garbanzo beans? Do I need those 3 magnesium? And so forth. And if you're not feeling better or feeling progression, then just go back because if the body doesn't need it, it'll take it in and it just stores it. And where does it store it? It stores it in the lymph system. It stores it in the liver. It stores it in the gut. It stores it in the small intestine. It's got to store it somewhere.
or
So
the
I
ad
think that
or the adipose.
absolutely. So I think it's important that we have a protocol, as I call it,
Mhm,
and we start. And then, I don't know, for me, it's like, okay, start, do it for 30 days because the body's anatomically designed pretty much on a 30-day cycle,
mhm,
how it's designed. Take it, revisit it in 30 days. And if that means that you can't feel what you need to do, then you go to someone who can help you. You go back to your doctor and talk to your doctor about it. And it isn't, the doctor cares. I think that's important for
that is
people to know. They really do care. And
yeah,
if you go back and you say, well, listen, I've been taking, this for this period of time and it's not doing anything, and that's medication. And you go back and you revisit it.
Well, and I think that brings in coming back a little bit, circling back to the accuracy in diagnosis.
Exactly.
It's a marginalized condition, and then as soon as a person had the diagnosis years ago, they marginalized the patient. So,
Mhm.
because we're dealing with those biases, um, and we're dealing with diagnostic biases. I don't know.
Mhm.
That's what I call it, where we refuse to entertain that which we don't think about. And we can only, as physicians, we can only diagnose that which we entertain.
Absolutely. And
And
I think people need to know that.
yeah. And so if a physician comes in the room and they're narrow-minded, and yeah, and I'm not trying to throw anyone under the bus, but this is a common scenario.
Right.
They're narrow-minded, they're busy, they're staring at the electronic health record. How do you engage the physician? I mean, we always talk about how do you engage the patient, and the physician goes, I can't get that patient to do anything. Well, what'd you do? Was my question.
Yeah.
Always back to my colleagues. Well, what'd you do in that room? And so if they're not engaging and sitting and listening to what the patient's story is, because if we listen to the patient, they're going to tell us what's wrong with them.
Yep.
They're going to tell us exactly what they have. They're going to tell us the diagnosis.
Yep.
And it's going to be in the details, and it's going to be in something that's said that's going to trigger you if you have that deep listening, which is your intuition. Everybody has it.
Mhm.
And we choose whether or not to listen to it, pay attention to it, etc. So then,
Right.
you know, and then we've got this diagnostic criteria. If I think of a vector and think of infections, well, no, that can't happen. You can have a tick bite and not get Lyme. Really, where?
Right.
Or you must have the
Exactly. Come
bullseye.
on.
Yeah, you must have the bullseye rash. Really, where? Whose idea was that? I mean, it's
Right.
just arbitrary statements. Well,
Yeah.
your test must be positive. Really? Maybe that's not the right test.
Right.
That's not the window of time when that test would be positive.
Exactly.
Yeah. And so we need to look at then a concept of vector differently that might be playing in. We need to listen to the patient and ask them to go back into their memory of when did this begin? When did they see a change?
Exactly.
What triggers can they see? What keys can they and levers can we push on to see if we can get a more accurate diagnosis into that fascial system? And then we've got like functional tests. So that could be micronutrients, could be
Right.
mycotoxins, could be environmental toxins, could be a gut test to look how permeable the gut is, which you don't want it too permeable. And you might have imbalances with the bacteria, which is the aspect of the microbiome. And then you've got the inflammatory tests, right? That can
Mhm.
look at, are we looking at like a polymyalgia rheumatica? That's one
Yep.
thing that didn't make it the literature, which I thought was fascinating because
Exactly.
that you ache all over, but it's more at the where the limbs attach to the body. We call that proximal. That's a word we use there. And then in the hands or in the feet, that would be distal. It's distance away from the trunk.
Mhm.
Proximal is in proximity. And so there you have weakness in the proximal areas and achiness all throughout your whole body. So it has very distinct
Yep.
characteristics to it. And your sedimentation rate is off the chart, usually about 40, 50, 60, huge, huge amounts. So that would take you down a different diagnostic criteria. Could you also have fibromyalgia? Well, you could. You could hurt all over, but you also have this other thing that's been clearly put in a defined box that can have a treatment option that's very direct for it. Yeah.
Mhm.
Um, and that even, I wouldn't underestimate a physician or a patient using their intuition towards that, because the intuition, when we talk about medical intuition, and when someone does a reading, I'm doing air quotes,
Mhm.
or a medical intuitive works with you, whether they're, trained as a physician or they're non-trained as a physician, but are gifted and skilled in that area, they're listening to your wisdom. They're pulling
Absolutely.
they're pulling it out of a squirrel's nest somewhere, or the
Absolutely. They're
or
taught their energy, their information is talking to us all the time.
exactly. We're listening to you at a different level. It's not
Exactly.
we're we're not down the toad hole with, we have a little toad that lives in our backyard in our drain pipe, and he comes up his name is Todd, I named him. Todd the toad who lives in the drain hole, and he comes up and I see him in the morning when I'm out there watering. He just kind of checks things out and then goes back down. And so I imagine him having little chairs in there and a lamp and other, I don't know. I mean, it just seems kind of fun. And but he just comes out and checks it out. I'm not going down into Todd's house to figure out what's going on with you. We're
Right.
listening to you as the patient, and you will tell us what's wrong with you. Yeah.
Absolutely.
So sorry about the segue with the little
Oh, no, no. Actually, it's perfect because one of the things that I also have found with fibromyalgia is that it's an opportunity for us to speak up.
mm,
It's an opportunity, and it's an opportunity for the doctor to ask questions, and it's opportunity for us to speak up.
mhm.
And, I will talk to people. I said, if you can go talk to your doctor, start putting together a list of all the things that you feel. Is it better in the morning? Is it better and easier in the evening? Do you have cycles to it? Do you have triggers to it? And write it all down because once you sit in front of the doctor, you're probably going to forget mostly everything.
Yeah.
And then the doctor can take this and listen and then respond accordingly and then come to their own conclusions based on what you're sharing with them. So it's a funny story with that. When my husband had dementia, we were going to the doctor, I would make all these lists of everything. And then I would go in and he'd go, okay, Carol, do you have your piece of paper with all the things on it? I said, I do. I brought the whole thing. And he goes, oh my God, this is 2 pages. I said, yes, it is. Isn't it great? And he goes, I don't know about that. And I said, well, I'll email you prior to the visit if you want me to. We laughed. It's like, no, I guess I'm supposed to just listen and ask questions. I said, yes, you are.
Yeah. And that is really our job. And
It
that
is.
job has been usurped by a variety of ways and in a variety of reasons for,
Yeah,
for all the wrong reasons and all the wrong ways.
yeah.
And that's why honestly I changed the nature of my practice to only work with patients and be outside of all the systems,
Mhm.
because that is when I do my best work.
Yeah,
And
yeah,
and that's why I became a physician, because I know I'm a healer, period,
exactly.
end of story. And I just happen to have tools and other skills I've learned, but at the end of the day it's really that interaction with the patient. So, and then we'll go a little bit into what fibromyalgia also does, is that it's a central pain processing issue. So I'm going to go into a little bit of a neural anatomy,
Yep,
because we haven't been there yet, you know.
right. And I think it's important for people to understand that it's also that.
Yeah, it's in the neurology. It's in the brain. It's in the central part. So central being brain, your
Yep,
frontal cortex, your upper higher centers, your midbrain, your brain stem back here, and the spinal cord, not out in the periphery, not out here.
exactly.
And there is some discussion with fibromyalgia that people have differencing in their patterning that floods up the system,
Yep,
which would be receptors. So could you see this more in people who are empathic?
yep,
Exactly.
exactly.
I would agree with you. And how we access our empath channels or highways are going to
Mhm,
be one of the main ways are chakras, right? It's the super
exactly.
highways. We know the chakras, when we look at those embryologically, come from the different, what we call GERM layers, or layers within our embryological development that are driven,
Mhm.
ready, by the nervous system, and then driven by that first and second cell that divided and came together, and which has its roots, here we go, you ready for the cosmic, into the soul,
Mhm,
which, and the subconscious, which is in and without, within and without,
exactly.
all around, right? Most likely part of that aura that you talked about, most likely part of our internals as well, like the microbiome and the guts,
Mhm,
and most likely that connection, or what I've come to call that as the biofield that we live in.
absolutely. And that's a perfect word for it.
Yeah. Yeah. And then when a physician or a healer, an intuitive, joins your biofield, there is that interaction.
Mhm.
There's an implied permission, there's often an asked permission.
Absolutely.
And with that permission, then you engage that person at multiple layers and multiple levels. And often you don't know exactly because you're some of that's in the subconscious,
Mhm.
you know. And so that would be then why Carol would say to a person, I'm going to put some words in your mouth for a minute. I have never done that, but I'm going to do it today. Have you thought of, or have you considered, right?
Exactly.
Um, or me as the physician saying, well, have you considered this, or have you thought of perhaps this, for reframing, or maybe this could be a consideration. And none of those things are ever meant to be contrary for a patient, or confrontive for a patient, or challenging for a patient. They're meant to be reframing, they're meant to be points of consideration, curiosity.
Absolutely.
Um, and then the other thing I want to mention before I'm going to toss this over to you, because I just hear you've got lots of stuff coming, is the overwhelm of the immune system. So, overwhelm, if we look at that word as an emotion, your immune system shuts down.
Absolutely.
So, the difference between being stressed, your immune system's activated and you're going and you're moving and you're doing your thing. Overwhelm is boom, crash. It's just crashed.
Yeah. Well, and it's interesting because our body is anatomically designed for stress.
Hmm.
It is not anatomically designed for overwhelm.
Yes, right. Yes, I agree. Because the bones are formed based upon the stresses placed upon it. Moore's
Exactly.
law. Our cardiovascular system, we train aerobically by the stress we place on our system.
Exactly.
And so we get better from stress. Now,
Exactly.
I love that Kelly Clarkson song, What Doesn't Kill You Makes You Stronger. Right now, unfortunately, what's going around our culture is what doesn't kill you makes you weaker. And
Exactly.
we coddle and we say, oh, that's okay, you don't have to. I say, that's okay, and you have to.
Well, and the interesting thing with the human body is because it is an expression of where we are physically and psychologically, is that we can choose to not deal with it psychologically right then and there, but it's going to circle around.
Right.
And
It,
it's going to continue to circle around until we say there's more to it than meets the eye and I need to look at it differently.
yes. And so I think that speaks to the point that I wanted to circle back around to, no pun intended, about, if you access physically, the body will heal. I think those could be, I see those some emotions that sit kind of in the way as maybe a linchpin or a hinge or something like that,
Mhm.
that doesn't allow us to fully heal until we look at those and deal with those.
Right, and I think we have to also look at what is the importance, and again, this isn't a judgment. Look at the importance of what that emotion gives us.
Yes.
What is important, and it isn't that it's trying to enable us to stay there, but what can we learn from it? How
Yes.
can we experience it differently?
Yes.
And I think that's really important when it comes to the healing is to just literally say, "Okay, well, for example, my um, emotion of choice that I always seem to go to is sadness. And it doesn't take much for me to feel sad. Well, I found as a medical intuitive that qualities of fibromyalgia is chronic sadness.
Hmm.
And so every time we feel sad, then the immune system is going to respond chemically. The body's going to respond in a certain way. And our energy is going to just zip, fall down around us.
Yeah.
And then so it's like even going in and saying, "Okay, my emotion of choice is sadness, and so what can I do to be able to change it?"
Yeah. Gratitude comes to mind.
That is the first thing because of the importance of the healing of all qualities of who we are. The key word is gratitude. Gratitude attitude. I'm not the one that quoted that, but that is the best medicine from my standpoint as a medical intuitive.
Okay, that's good to know. I'm I'm grateful that I knew that.
I'm grateful for you for bringing it forward so I could share such things, Mary. Gratitude is playful, by the way.
Yes, it is. It
It's not the mental thing like, "I'm grateful for this biscuit in front of me." It's like, "I am just grateful. I'm just a happy, grateful person." It's
right,
very, very enlightening. It's very
yes.
enlightening.
It is, it is. And so I think looking at the healing of the whole person, we would want to see that, understanding, looking at, the pain, the patterning that goes up, because,
Mhm.
the thing they're now leaning towards in fibromyalgia is pattern recognition. What's happening,
Yes.
patterning. And, when we look at genomics, it's pattern recognition. When we
Yep,
look at the microbiome, what is it? Pattern
yep,
recognition. When we look at the emotions, there's a pattern recognition to emotions. There's the 4 Bs that Brene Brown teaches that I have adopted, just firmly in
yep,
my care is you've got the emotion, then you've got the biology, the backstory, the behavior, and the biology, backstory, behavior, and biography. And
exactly.
she explains those in her book, The Atlas of the Heart, which I actually use as a textbook for my patients.
Yep,
And if I'm dealing with some deep emotional things that's linked with their fibromyalgia,
mhm,
I have them explore this book because there's 87 emotions in the book. And
exactly.
she defines them according to emotional research.
Mhm,
And so, what we tend to do as humans, and she found this to be true when she surveyed them, they came up with 3 emotions: happy, sad, and pissed off.
yep,
And so, if I give you those 3 words and a fully paid vacation to Walt Disney World, Carol, and say, great, come on back, but you can only use those 3 words,
right.
the limit of your experience is huge.
Yep,
And the limit of your ability to tell the other person anything about it is super restricted.
exactly.
So the more we have words to understand and nail and identify different emotions or feelings, the richer is our experience.
Yeah. Well, emotions are our best friend.
Yes.
Because they're an instant read of where we are in our thinking, and where we are in our thinking is exactly where our body can be or will be.
What if, I'm curious about this,
Mhm.
the more emotions we have, the less fibromyalgia we have because we aren't patterning.
Absolutely.
So we would be, more random emotions,
Exactly.
right?
And we would stop putting the stigma and the victim on and the behavior associated with just those few emotions. I mean, we're designed in the head and heart anatomy of who we are to be just a myriad of emotions.
Mhm.
And those
Joy,
emotions can
yeah,
be happy and
yes,
sad in split seconds.
right. Yes, that's that laughing, crying emoji on your phone.
Exactly. Exactly, exactly. So again, if we can see and I have a friend who is a psychologist who says to me over and over again, "Tell your clients that emotions trump logic,
Yeah, they do because 'cause they're gonna yeah.
and then have them just embrace all the emotions."
Mhm.
So,
Yeah,
yeah.
and I think so being able to do that in a non-judgmental way because then that gets into
Yeah,
your backstory. Where was it not acceptable for you to have that
exactly.
the biology is your family. What's that DNA? What did you inherit
Yep,
that goes along with that emotion? What came down that lineage?
yep,
And the behavior part then is, what do you do when you have that emotion?
exactly.
Yeah. Um, yeah. So those things become really important to understand. And that's one way I teach my patients about, go home. Your homework for the week is identify 2 emotions every day. So 7 days, 14,
Right.
and then write the 4 Bs about them:
Yep.
biology, the backstory, the behavior, and the biology.
Yeah.
And then when you do that, or biography, and when you do that, then you're going to begin to understand about that. I said, don't write
Yeah.
paragraphs, just bullet point it, you
Exactly.
know, because and then I want you to want to know where you feel that in your body.
Yeah. Well, and for me as a medical intuitive, that takes what has been pent up inside or buried or whatever thing. And again, no judgment with that. And it gets it out to the light of day. It's on a piece of paper. You can look at it. Therefore, it becomes a word.
Hmm.
And then if it becomes a word, then you can look at the word in a way that, oh, it's just a word instead of having all that attachment and the entanglement that goes with it. So, it's again, you don't have to write pages in a journal. You just have a lot of times when I work with clients, I say, go out and buy the most beautiful journal that you just absolutely have to have your hands on. Color, bling, whatever it is. Find the pen that you just absolutely have to touch. And every time you feel an emotion, write it down.
Hmm.
No judgment, just write it down.
Yeah.
And then what you can do is you can go back and you can look at patterns in those emotions and you can feel what that, because the body responds to it. You can feel what that emotion is doing. Is it locking you down? Is it opening you up? Are you feeling like you can't move? Whatever it may be. And then just say, oh, okay, well, it's just a word.
Yeah.
And again, what is the backstory that goes with it?
Hmm.
But you don't have to dwell on that.
Mm-mm. No, and there's ways to actually process it through the nervous system,
Oh, absolutely.
because the nervous system is meant to heal. And
Yep.
because the nervous system is based on pathways and patterns,
Yep. Exactly.
and cellular response that usually primarily goes both ways, most,
Right.
you know, really at the end of the day. And our lower brain, which is our breathing and our basal stuff, keeping our heart rate
Hmm.
and breathing. And then you've got the midbrain, which is kind of still the reptilian brain, where the emotions get stuck. So it's
Exactly.
those loops. And then the frontal cortex, which is supposed to drive everything. There's our logic. Can we get to the logic, please? you know
Right.
After and we can only get to the logic after all that flooding up goes
Yep.
away,
Yep.
right? Because that's cut off coming down because so much is going up.
Exactly.
So,
Exactly.
we can repattern those pathways. And the body knows how to do it because it's designed that way. We don't have to teach the body. We just have to like open up the gates for rewiring. And it's like it really is kind of like Simon Says, or open sesame. You're getting just the right
Absolutely.
words. you know,
Exactly.
and I put it like, well, if you're chewing gum and you're going to go somewhere, put on your vest and look down to start the zipper, but zip up because you don't want to run into something. But the immune system or the nervous system, just like that, it will know how to,
Yep.
if you start the zipper correctly, the rest will happen.
Yeah. And I think that that is that neural component, that neuromuscular component of fibromyalgia.
Hmm. Yeah.
Exactly right there. Because we know the nervous system is involved in it. And that's exactly what it is. It's just that flooding that's coming up, the nervous system reacts accordingly, the immune system reacts accordingly, and everything just goes into protection. And it's trying to help you.
Yeah.
It's not trying to ruin your life. And then when you recognize that that's going to be the response, then it's like, oh, here it comes. Here it comes. Oh, there it goes. There it goes. And
Yeah. And even, bring that into your consciousness by giving yourself permission to let it come and go.
absolutely, because we are anatomically designed to be human and spiritual at
Mhm.
the same time, simultaneously. There is no, contrary to what we believe, the left hemisphere may be this and the right hemisphere may that. Well, that corpus callosum in the center is the pathway, it's the gateway. Everything's always happening at once. And
Mhm.
that's exactly how the body heals right there.
Mhm. So, fibromyalgia,
Hmm.
malaligned, misdiagnosed, mistreated, probably overtreated, undertreated,
Yes.
all those things. Not male or female, not old or young, has a lot of contributing factors, infections, trauma, hormones, toxins, environment, stress, genome, microbiome, all those levers we have access to.
Mhm.
Start where you either want to start because you have a curiosity, start where perhaps you're more frustrated, or perhaps you see a greater win. Depends on how you're wired. But
Mhm.
know that the fibromyalgia has been keeping you in a box, in a tight wetsuit, rigid, not able to move, and your life is actually waiting for you to be fluid about. Your life is
Mhm.
waiting for you to be in resonance with, in connection with yourself and with others. And then the patterning of the emotions, the patterning of the subconscious, the beliefs that hold all that, that allow those to come to the surface. It's safe because those will come to the surface when it's safe.
Yes,
It will.
absolutely.
And learn about those, learn from those, learn. And when you name an emotion or a feeling or an event, it doesn't have power over you. You all of a sudden have power with it or over it. It doesn't you it's they it no longer holds you.
Exactly.
And we aren't even talking about, you know, other aspects of our do you have to forgive or do you have to we aren't even going there.
No.
We just live with the concept of the things that you're experiencing that you can allow to come to the surface to be cleared so that your fascial system,
Mhm.
your myofascial system, your fibromyalgic system can actually move and groove and have a great time. Um,
Yeah.
so,
It's one of the things that we were talking about what can we offer, someone to do. And one of the things I consistently hear with people with fibromyalgia is they can't stand to be touched.
mhm,
They just don't wanna be touched and everything. So I'll say to them, I said, "Okay, so here's the best medicine for me. Every day, at least 3 times a day, I want you to give yourself a hug."
mm,
And they go, well, why would I do that?" And I said, "Because you love yourself. Your body is you love what you're doing. You love who you are. You're embracing who you are. You hug and you go to your heart and you touch your heart and everything." And they say, "Oh, well, that's not gonna do anything." I said, "Oh, you don't understand the muscle structure. If you go to give yourself a hug, you're using the trapezius. You're using all these muscles that you don't do when you don't want to be touched.
mhm.
And pretty soon, you not only like the hugs, but all of a sudden the right arm comes over and then all the left side comes over. Now the hips start to move and everything. So for me, just love yourself, give yourself a hug 3 times a day. Why 3 times a day? Because we have 3 qualities: physical, energetic, and soul.
There you go.
And if you give
Beautiful.
yourself a hug 3 times a day, one of those hugs are going to go to one of them or to all of them.
Wonderful. Beautiful. Well, Carol, this has been another great episode of Cosmic Health and Wellness. Out to the cosmos and back. That was fun trip.
We feel like do you feel like Buzz Lightyear to the beyond and back?
I actually do, and I think of Disney World rides when I speak with you. So yes, it's exactly it. So remind folks how they can get a hold of you because they want to connect, they want to know more, they want to have a session with you. How can they best reach out to you?
www.ritberger, ritberger.com. That's my website. They can learn all about me, my backstory, and then they can book a reading with me if that's something they're interested in.
Great. And then, as our illustrious co-host to you, I am Dr. Mary Lauder here in Holland, Michigan, downtown Holland, right at the corner of River and 8th Street, which is the heart of it all in Holland. It's a great place. And so you can see me in person there. You can book an appointment going to drmarylouder.com, MARYLOUDER.com. And we thank you for joining us on, since you put it that way, Cosmic Health and Wellness, Fibromyalgia Part Do. What do you do when you've got it? And there's lots to do because you're meant to move, you're meant to groove, you're meant to live a just very fulfilled life. And we're happy to help you do that. So thank you for listening today, and we'll see you next time.
Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.